Yeah, thanks for joining, everyone. Welcome to today's webinar. My name is Arkadiy. I'm the founder of Filia with Therapy and the registered psychotherapist. And I'm really glad that you could join us in this webinar. We have Huma here tonight. She's a wonderful art therapist and a registered psychotherapist here in Ontario. And in a bit, we'll have her tell about her experience and her expertise. She has worked in many countries with different clients and populations, helping them through art therapy and EMDR. And today we'll focus on art therapy, a really unique therapy approach. For many of us, when we think about therapy, we think about traditional talk therapy, first of all. And it's a great way for processing our emotions, building our resilience, developing coping skills and tools. But art therapy offers something really different, a chance to express and explore our feelings in different creative ways. At least the way I think about that. Probably by the end of today's webinar, I'll know more about it. And yeah, we'll discuss how art therapy can benefit different clients of different ages, different backgrounds, and struggling with different challenges and issues. And if you have any questions, please feel free to type them in the chat. I think our conversation will take maybe about 30 or 40 minutes, and then we'll reserve some time to answer all the questions that we get. So let's begin. Huma, maybe you can tell us a bit about yourself and yeah, how you first encountered art therapy, maybe.
Yeah, no, thank you for the brief introduction, Arkady. So I've recently moved to Toronto from Singapore, where I was in private practice for more than 13 years. Well, I've lived in Singapore for more than 20 years. I'm originally from Pakistan. And yeah, I've been an art therapist for since 2011. I did my doctoral research in art therapy and autism. And yeah, here I am today. I'm a passionate believer in the power of arts and the healing inherent in it. So yeah, ask me and
Okay.
any questions. Yeah, I'm happy to always very happy to talk about art therapy.
Yeah, that's amazing. Yeah, maybe you can tell us a bit. Right, I try to kind of share my impression or what I know about art therapy, but maybe you can tell us about what art therapy is as an approach, right, and how does it work?
Yeah, sure. So let me demystify it because a lot of the time, I get these questions when I tell someone I'm an art psychotherapist. They'll be like, we've never heard of that. What does that really mean? So basically, art therapy is a form of psychotherapy where the creative expression is used to express the inner self. So if you consider language, verbal language, a means of communication, look at art making as a second means of communication, another way to communicate the inner self.
Okay.
So when you incorporate art making inside the session, you are basically tapping into a resource that is not available necessarily available to words, which sometimes we can also use as defense mechanisms. And so, what the art making does it goes into your subconscious, into your unconscious, more into your emotional brain, and it can tap into emotional material that may not necessarily be accessible to words. So, well, essentially, in a nutshell, that's what it is.
Okay, yeah. So words, right, offer us a way to express ourselves, but at the same time, they have their limitations, right? And art therapy provides us
Yeah.
a different way
So, in
to.
a very simplistic way, I think of it as verbal language is rooted, let's say, in the cognitive brain,
Mhm.
and art making or creativity in the emotional brain, right? So when you make art, it's tapping into that emotional brain of yours. Very often that is
Mhm.
associated with our primitive brain structures, our limbic system. And when we just use words, we're primarily using our more of our higher functioning
Yeah.
brain functions, right? Where we are rationalizing things and we're looking, thinking logically and so on and so forth. And we tend to sometimes shut down our emotions or put them on the side, or we may not even be aware of them.
Hmm.
So your art making creates a bridge between your emotional as well as your cognitive brain. And so the material that comes out and the information that comes out is so much more richer, and can be very, very, I would say, sometimes surprising for the person who's making the artwork.
Hmm.
Yeah.
And do I hear it right? That's right. So that one part of that would be expressing yourself, right, through creative means with the support of the therapist, and then another part would be working with that result of your creation.
Yes. So there's a lot of confusion about, people say, oh, but I make art, right? I,
Mm,
I make art myself, and that is very therapeutic. So yes, art making, drawing, painting, sculpting, any kind of creative activity is therapeutic in itself. But the role of the art therapist, who is obviously trained not just in various psychological theories,
mm,
um, um, and also knows how to, let's say, hold the space and contain the emotion of the client, is to take that art making a few steps further. So
mm,
you take it from the creation of the artwork to reflection on the artwork,
yeah.
and then also to problem solving or healing. So facilitating the journey of the client, of the person, of the individual, um, uh, through the whole process, starting with the creation of the artwork, and then reflection on the artwork. So
Okay.
it just doesn't stop, at
Hmm.
making something and creating something. It goes way beyond that.
Right. So this makes this process more mindful, right, more kind of focused, more
Yes,
intentional.
yes, and it goes really in depth. It goes really in
Mhm,
depth, into information that may have been dormant for years, rooted in maybe your childhood, or sometimes, especially when it comes to trauma and trauma memories, they are stored in the body.
mhm,
Not just in the mind, they're stored deep into the body. So, because art making is so multisensory, uh, again, you can tap into those areas of the body,
yeah.
um, and where that information is stored, and help. The art therapist will, assist
Mhm.
in, facilitate the sort of expression
Yeah, that sounds,
of,
yeah,
of yeah,
pretty impressive. Yeah.
yeah.
And in our professional journeys, I think, right, we find the approaches, the theories that just more resonate with us. And so these are the theories or approaches that we incorporate in our practice. What drew you to art therapy? Right? How did you make that connection, and what appealed to you?
Okay, so yes, so even art therapists will tend to have different orientations.
Okay.
Just like someone, in talk therapy does CBT, or you may be more humanistic in nature, and so on and so forth. Even with art therapy or art therapists, like I'm attachment focused, right? And so I work within the framework of attachment. When I'm working with children, I use a more developmental kind of approach, or a sensory
Mm,
based approach. So you have all those psychological theories. You can incorporate CBT, you can incorporate DBT, you can if you can specialize in OCD, in eating disorders, so on and so forth. um, Going back to, did you ask me whether how I came upon
yeah.
the art? Okay, well, that's an interesting story. So I graduated. I have a background in art. I graduated from an art college. I did textile design eons ago.
Wow.
And in my early 20s, when I had my first child, my son is autistic, my firstborn. That was a period of great difficulty for me. And I developed chronic anxiety. So I went back to my art making. I painted a lot. I remember, and it was a way of expressing my own maybe frustration, my own pain, my very high anxiety levels. And it was around that time that my therapist told me to look into art therapy, which was a relatively new profession in Singapore.
Mhm.
And so I went for an introductory workshop just to see, okay, what is art therapy. And she told me, this is something that I think it fits you very well. You'll be able to
Hmm.
look into it. And I went to that workshop and I was blown away.
Okay.
It was like I began to realize or understand what my own process was or had been while I was, expressing myself or unloading myself onto my artwork. But then this was, a few steps ahead. Like I said, it
Right.
was much more than that. It was psychology and art coming together. And it is so fascinating. It's so
Wow.
fascinating that I said, okay, yes, I have to do a master's. and
Yeah.
uh, then I just went for the master's program, and then there was no turning back.
Wow. Yeah. That's so great hearing how a personal experience kind of drives us and to right, that for yourself, right, how that can be changing and transformative. Yeah.
Yeah.
Thinking about what issues actually, right, art therapy can help clients with, are there any limitations on that, or is it an approach that can be applied to any kind of an issue or a challenge?
So, art therapy, first of all, can be done by any age group. So, starting from 3 years of age, I would say, I mean, at least I can work with someone as young as 3 years to upwards to adult to the elderly. And by and large, like I said, different art therapists will specialize in different areas, but you can work with all kinds of mental health issues, ranging from personality disorders to eating disorders to OCD to depression, stress, trauma, and so on, and even just less complicated stuff. For instance, just people looking for direction in life,
Hmm.
relationship issues, marriage counseling. So it can be used in any, I would say, across a range of issues. In some cases, where psychosis is involved, for instance,
Hmm.
it's used as a supportive modality. So it may not be the main intervention, but it is used as a supportive modality.
Okay. Yeah. That's great to hear. Yeah, the more I hear you kind of share, the more I understand that art therapy just gives another dimension, right, to therapeutic work. Right, it can be combined with a different approach. It can be combined with
Well,
different.
interestingly, you know how art therapy began, the profession itself. It was used by psychologists
Okay,
in the early
I know
20th
that.
century. Yeah. So, people, professionals who were working in the mental health area at that time, they developed an interest in the artwork of people in the asylums.
Hmm.
And they saw that the artwork was very authentic and it was so expressive of the internal workings of their mind. And so they started incorporating it in their work. So you would, you didn't have art therapy then, but you just had
Hmm.
psychologists, so psychoanalysts rather at that
Hmm.
point in time. I'm
Yeah,
talking about the early 19
in the 19th century. Hmm.
1900s, 1940s, and so on. So art therapy then developed around the 1960s, if I'm not wrong, is the time when it actually a separate literature developed for art therapy, and
Wow.
then art therapy sort of came into its own. So it's very much rooted in psychological practice. It's been there for the past century and a half.
Hmm. Wow.
Mm.
Yeah, I didn't know that. So,
Mm.
and I think you mentioned that right, any form of expressive art can be used right, by art therapists to work with the client.
So there's like art, there's the umbrella of creative arts therapies.
Hmm.
Under that, you have the music therapist, the play therapist, art therapist, drama therapist, sound and movement therapist, the expressive arts therapists, and
Hmm.
the arts therapist. I'm specifically an art therapist.
Hmm.
I'm not trained in music therapy or play therapy, but I will in my sessions, if required, especially with young children, I can incorporate certain elements um, from those two, disciplines. However, I can't say that I'm trained to do that. The
Hmm.
expressive art therapist will be trained across, multiple
Okay.
disciplines, and they will use a combination of things. So it depends on what your area of training
Hmm.
is.
Wow. Yeah.
Yeah.
It's like such a big field, right, with many different
But I
specializations.
just want to add that when you say creative expression or creativity, So, people might wonder, do I need to know how to make art? Do I need art making
Yeah.
skills to do art therapy? No, you don't. Not at all. In fact, um, sometimes I tell clients, if you can, you know, even scribble or hold material and, let's say, engage with material, any
Mhm.
kind of material, to create something that's good enough. For instance, I've worked with nonverbal children, who are not capable of representational art making. For instance, they can only engage with art materials, meaning,
Mhm.
maybe just play with paint or just apply paint or whatever, and that is fine as well. So there, in that case, I will use what I call a developmental art therapy, a sensory
Mhm.
based approach. There, I've worked with people who were artists, who make fantastic artworks, and that's fine as well. And then there are those who just come and express themselves, maybe through scribbles, through just splashing paint, or just in any which way, because there's no right and there's no wrong.
Mhm. Yeah.
So yeah, I mean, it's
I appreciate you saying that because I think this can be an obstacle in even considering art therapy because right, when it comes to speech or right, we are just familiar with that and we assume that it's just a way to express ourselves. It comes natural. But when it comes to art, there are often right, expectations, right, and some assumptions that people may have. So
yes,
it's
because
great to hear.
unfortunately, we've forgotten that before language ever came into existence, we were artists, right?
Mm,
In
mhm.
ancient times, and we've kind of left that behind, and we've relegated it to, oh, maybe an art and crafts lesson in
Yeah.
school. But actually, creativity resides inside us, all of us, and we tend to just stifle it. There's a lot of confusion around, oh, art therapy is an art class, it's not that. It's just another way, a way of expressing yourself. It's a very natural way of expressing yourself,
Mhm. Mhm.
right? I mean, we sing, we listen to music,
Yeah.
why don't we make art? Why don't we draw? You know,
Yeah.
some of us, like, I love doodling, for instance, and so it helps me concentrate. It helps me
Mhm.
think. So even with art therapy, do you know that different art materials have uh, different sort of capacities
Mm.
to evoke certain emotional responses? I mean, to put it very simply, paint, for instance, can go very deep into emotional content and
Okay.
put it out. It can be hyper arousing. It can
Mhm.
cause it can make you feel very emotional. Let's just put
Right.
that.
Because there's
Put
a
it
lot of freedom in it, a lot of intensity,
Yes,
yeah.
because it's
Mm.
fluid and it's
Yeah,
hard to control, and there's something about the texture and the application of paint.
yeah.
And a pencil, or let's say ballpoint or marker, is a much more rigid medium.
Mhm.
It lends itself to control. So sometimes when, let's say, you're highly anxious, you may just want to use pencil and not want to touch paint.
Yeah, there's more control, yeah.
Yeah,
Yeah.
because you have more control, you can control the outcome, and then you can make repetitive movements with the pencil.
Mhm.
So the art therapist is trained to understand what material is needed at what point.
Okay.
So let's say if I have an individual, a client who's coming to me for a few sessions and very closed, not wanting to maybe open up, and I want them to kind of, want to open them up a little bit more and to have them relax, I will, maybe in the beginning of the session, I will have them do an activity like a warm up using paint.
Okay.
Maybe, big movements of paint on the floor and on a large piece of paper. What that will do is that will relax them, that will open up their sort of internal channels,
Yeah.
and then, yes, they're ready to go deeper
Yeah.
into their inner selves.
Yeah, even imagining myself doing that, yeah, I can imagine, yeah, how that can be.
Yeah, yeah, it's really amazing. And then
Mhm.
on the other hand, let's say if someone's getting really dysregulated, which means, exiting their window of tolerance and becoming anxious during the art making, you can substitute one material for another to bring
There's
that calm.
flexibility in that.
Yes,
Okay.
yes. to bring
Wow.
the calmness back into the session and to close the session in a very secure way. Yeah, so that's the magic of the art
Never
material.
considered that. So yeah, and as we're talking about what can happen, right, in an art therapy session, can you maybe walk us through, right, what if there is a typical art therapy session, right, if it is even a thing,
Sure,
right?
sure.
What can it look like? What can a client
Yeah,
expect?
of course. I mean, of course, there's with each client, it's very, very different. But just to give you a very typical sort of idea. So, a client comes in, let's say it's the first session that they come in. I might, and I, let's pretend that this is a client who's nervous and who's a bit anxious, and
Yeah.
so what I might do with them is actually to break the ice. I might even do a joint artwork with them. So I'll just say, okay, let's work together and create something. You just, I'll doodle on this side, you doodle on that side, and so just get them sort of relaxed. Then I will say, okay, now introduce yourself to me, and I might give them a directive like. Um, Draw yourself as an object. It could be anything. You can draw yourself as a plant, as a person, as a table, chair, ball, anything whatsoever. So they'll engage. I'll give them a variety of art materials, and I'll say choose whatever you want to. Now I'll be paying attention to the kind of art material they're picking, right? The way they're applying it to the paper, the
Okay.
choice of paper, how much paper they're using, their body language in general, and then of course the end result, the product itself. And once they've created the artwork, is when I will start asking them questions about it. Okay,
Okay.
share about your artwork, and they might say, let's say, I'm a ball, right? Okay, so where are you?
Mm,
What environment are you in? Or they might say, okay, I'm inside a room, right? Okay, so uh, what kind of an atmosphere do you see in the room? What do you see around you? How is it? Is it morning? Is it evening? So you just kind of take that conversation further, and you're a ball. Why a ball? And there are many things that might come to your mind.
mm, okay.
Maybe because I can be kicked around, for instance,
Yeah.
right? As
Hmm.
opposed to a chair or a table,
Right.
right? And oh, is that how you feel? That you
Yeah.
feel like you're being kicked around? Yes, and so on and so forth.
Okay. Yeah. So you help the client like express themselves, and then you
Yes,
work with that expression, right, to understand
absolutely. So
that.
you follow the client's lead. I'm not going to interpret the work for them, though.
Hmm.
I
Hmm.
might get cues into what might be happening or what this could mean, because there is research that tells you, okay, well, there are certain elements to look out for, but
Hmm.
I'm not never going to impose my own interpretation on it.
Okay.
And the interesting thing is, and something which empowers the client themselves, is that they are the ones that guide their own process in a way.
Hmm.
I facilitate it, yes, but they are the one who develop the capacity to
Wow.
reflect, to understand their own selves, and then to come up with the solutions. So
Hmm.
that's the beauty of it. Uh, to give you just one more example, let's say you're further into the sessions, it's session number 5 or 6, and I want to create more self-awareness into a particular client. I might give the directive of an inside-outside mask. So you get these paper mache masks.
Hmm.
I would tell them, okay, paint or design or whatever color, use whatever art material, and the outside of the mask is how you think the world sees you,
Okay.
and the inside of the mask is who you really are. So that's a very, very powerful
Wow.
intervention.
Yeah.
Yes.
Yeah.
And usually, I mean, there's loads of information that comes out,
Right.
and it can
Yeah.
be very, very surprising, because remember, you're using art material that is going to tap into pieces of information that you may not even have thought about. It's just
Right.
going to it's just going to come out,
Yeah.
especially if you feel safe with your therapist.
Yeah.
And so that's going to happen, and then it's going to be there in front of you in a visual form.
Yeah. And you can interact with it
You can
directly.
interact with it, you can
Yeah.
have conversations with it, and not just in the session. It stays with
Hmm.
you
Right.
as a
It's something
gift.
tangible, something real. Wow. Okay.
Yeah. So
Yeah.
this is just a few things.
Oh, yeah,
Um,
that's amazing. Yeah. And are there differences in how you adapt the process for different age groups? To be frank, right, for a long time, I only thought that right, art therapy is something that can be helpful for children, right, or teenagers. But I understand, right, there are no limitations in that
no,
regard.
no.
Um, are there ways that you adapt the process? You mentioned, right, that for children of an early age, this can be more with a developmental focus, but maybe there are other considerations that right, are there.
Yes, so I mean, you're going to keep in mind the chronological as well as the developmental age of the child,
Hmm.
the emotional age of the child, because naturally, maybe a 5 or 6 year old is not going to be able to reflect um,
Right.
and self-reflect and all. So you simplify the directives and you engage with them at their level of cognition and understanding, right? But you can do, I mean, with an adult or with a teen. So you have to understand human development, like
Hmm.
any other psychologist or counselor. You have to understand human development and where that person is. So you make that judgment,
Right.
and then you the directives will vary according to that. So they can be very, very specifically tailored towards the need of any client. If you're working with, for instance, I'll give you an example of this
Okay.
uh, one girl who was 12 years old, and I was uh, working with her. And so she had some social skills issues in school and some behavioral problems. And interestingly, her artwork, and she was doing very well. So
Okay.
academically, there was no problem, but behaviorally, there was something going on. So when she was drawing, her artwork was not reflective or did not match her age, chronological age. And I was curious that, you know what, it's much younger emotionally than her chronological age. And, she's an intelligent child, is doing well in class. What's going on? What I found out was that at 9 years of age, she had actually fallen from her from the second or third story of her of her apartment
Wow.
and injured her brain. And so she had suffered immense trauma at that time, and her emotional development had become stunted at that point because that trauma had not been processed. Her
Hmm.
artwork
It came to
had
this.
revealed that information,
Hmm.
whereas if she was talking verbally, you couldn't tell,
Wow.
right? So the artwork is also, because there are different stages of development of the artwork. It is also indicative of the emotional development of the person, or the
Hmm.
cognitive development of the individual. So it tells you a lot, and then you tailor your approach or your directives according to that.
Okay.
You have
Yeah.
to. It's an ongoing assessment. Each session is like an assessment of where the client is at, and yeah. But to answer your question, simply, any age group can do art therapy. So
Hmm.
I've worked with people with personality disorders, with OCD. I haven't worked with the elderly, but there are lots of art therapists. I don't know about here, but back in Singapore, in old homes, in working with people with dementia, with Alzheimer's, and all.
Okay.
Yeah, and in hospital settings, yes, of course.
Hmm. Sounds like there's something universal about tapping into our like, emotional brain, emotional part of ourselves, and to being able to access that and to channel it.
Mhm.
Mhm.
Yeah.
Okay. Yeah. There was something that you said about right, combining art therapy with other therapeutic approaches that sounded really interesting to me. That's right, you work from an attachment-based perspective. So right, the way I work is I use mostly kind of CBT and EFT. How
Mhm.
would art therapy kind of fit my practice? So right, maybe you can give us a couple of examples of how art therapy can be combined with.
Well, like for instance, with CBT, I'm not CBT trained, but of course
Mhm.
I'm familiar with it. So you are basically targeting the um, the conscious thoughts,
Mhm.
and you're trying to retrain, or and you can, I mean, correct my my language if I'm not using the right words, the thought processes, right? So you're
Absolutely.
working at, let's say, if you visualize the human brain as a, as an iceberg, you're working with the tip of the iceberg,
Hmm.
right?
Yeah.
With art therapy, you're actually working with what's under the water.
Hmm.
So that's how you could incorporate it. Yes, you apply the CBT and you address the behavior, but there are underlying causes to the behavior.
Okay.
The behavior patterns are rooted in something, right? They're not
Hmm.
just there because of a reason. The art making will take you into that, the
Right.
bottom of the pyramid, the
Yeah.
iceberg. Sorry.
Yeah. It can take a very long time to do that through talks, through
Exactly.
cognition,
So
right?
it's
And,
going to break those, like I said, those
right.
defenses. It's going to break
Hmm.
the surface of that water, and it's going to go down. So you can use CBT, right?
Hmm.
In the same session, you can continue to use CBT. Maybe, I mean, like for instance, if I say I use CBT, I mean, I of course I don't, I can't say that I use CBT, but I do address the behavior also.
Right. Of
You
course.
have people coming in who want immediate solutions, like, oh, this is, I'm highly anxious, I need to function, right? So you
Yeah.
will have to use elements of CBT or
Hmm.
some kind of a behavioral approach, because people have to function. They have to,
Yeah.
go to work or manage their families and so on. But so I will use that, but maybe, half of the session will be then digging deeper
Hmm. Hmm.
and
Yeah.
addressing the root of the issue,
Yeah.
so that if the behavior changes, it's not a superficial change. It's much
Right.
more
Yeah.
deep.
Yeah. It's deeper. Yeah. And I guess it also provides much more material to reflect, right, to explore,
Yes, yes.
to.
Self-awareness is such a powerful thing.
Hmm.
Being aware of why I'm feeling this way, what is happening with me, my behaviors. Well, there's a history. I am not just, I'm a sum of all my parts.
Yeah. Yeah. Of
Right?
all my experiences.
Yes. Yeah. Yeah.
Mhm. Oh, yeah. That's pretty amazing. Yeah. I wonder if there's anything right about art therapy that I missed with my questions. Something that would also be important for our participants to
Um,
hear.
well, I think you've covered a fair bit.
Okay.
We could not keep on talking, but
Yeah.
I think maybe we can take some questions and,
Yeah. Like I said in the beginning of the webinar, please feel free to use our chat for the questions. We have a couple of questions already, so maybe we can start with those. So the first one is if an art therapist can diagnose a condition. I think it's kind of more general question, right? Applied to just the position of therapist, but yeah, maybe you can
yeah, no, I mean,
address that.
we're not allowed to, and I think even like any psychotherapist is not allowed to diagnose. It's strictly a no. That is the job of the psychiatrist, right, or the doctor. So no.
Yeah.
Would you like to add something to that, Arkady? Because
No, yeah, you're absolutely right. Yeah, in Ontario, it's prerogative of psychologists and psychiatrists to provide diagnosis, and yeah, psychotherapists either work on the basis of a diagnosis
mm,
provided by another specialist, or we just work with clients who don't meet the criteria for a medical diagnosis, just need support with some other challenges. So, yeah. There's another question. Is it there are different kinds of art therapy for different conditions, depression, bulimia, OCD, or bipolar? I think you touched upon that, but maybe there is something you would like to add to that, Huma?
yes, so like I said, I mean, different art therapists will specialize in their area of interest. So yes, we have a lot of literature on, eating disorders and art therapy. I've written on autism and art therapy, and then of course depression, art therapy, OCD, and all. So yes, but just like any other psychotherapist, not everybody can work with
Right.
every. Yeah, so
Yeah,
so
you need specific
you would need
training.
training. You would need training.
Yeah. Yeah.
Yeah.
Yeah. Makes sense. Okay. There's another question. What type of clients do you typically work with, and what goals do they wish to achieve through art therapy? Yeah, that's a great question, actually.
Okay, so when I'm working with children, a lot of the times the issues are related to behavior dysregulation. Like, the child is impulsive and doesn't know how to manage their behavior. So, in school they might be either indulging in negative behaviors, or they are, throwing tantrums, or then the social skills issues. So it's either that or that. And then, I've worked a lot with also parents, children of parents who have divorced or separated. So that also. um, some of the issues are also attachment related, in the sense that um, when the child was born, the mothers were either going through depression, postpartum depression, or not able to develop a bond with the child. So you have to then, you do healing of that attachment. Yeah. So with children, it's mostly that. With teens, it can be self harm. I've worked with that. Also, boundaries issues related to
Mhm.
behaviors. Parents are struggling to manage certain behaviors. Then sometimes some of the um, children, the teens, they are struggling in school, and they basically slipped through the nets, where there is some kind of a either an emotional or developmental issue that the school has missed, or the parents have actually overlooked and not investigated. So this has happened quite a few times, when the client will come in, and then through their art making and through interacting with them. I should mention that I before I became an art therapist, I was an educational therapist.
Uh,
So I've done remedial teaching. I've interacted with kids with ADHD, dyslexia, and so on. So I kind of have that background as well. So I'm
mhm.
able to pick up certain things that, you know, um, as an educational therapist as well. So yeah, so those are most of the issues. With adults, it can be relationships, people looking to get over traumas, to
Mhm.
process traumas, childhood traumas, actually. And that's where I bring in the EMDR, which is the eye movement and desensitization and reprocessing. For those of you who are not familiar with that, it's basically tapping into the memory network that can go as far back as your childhood, early childhood days, and desensitizing certain memories, which may be affecting your emotional and development and behavior in your current adult life. So I've worked with clients with trauma, and the goal is usually to, obviously, is to feel well, is to feel less anxious, for instance, or to be able to have fulfilling relationships.
Okay. Yeah. Thanks. Yeah. Sounds like these goals can be really different for different
Yes,
groups of
absolutely,
clients, which
absolutely.
makes a lot of sense.
Hmm.
Okay. We have one more question. Oh, two more actually. How to incorporate art-related techniques for a client who is closed off about it or hesitant?
That's a good question. Actually, I've worked with clients who are not willing or interested to make art.
Mm,
Art therapy may not be for everyone. I'm not claiming that, right? Having said that, I am trained as a psychotherapist. Art therapists are psychotherapists.
right.
So when a client, comes into the session, and I can't force them to make art, and I don't force them to make art. If they're willing to do so, fine. If they're not, then I can do talk therapy with them.
Right.
So, but sometimes people are hesitant to
Mm,
interact, to make art, because they are not comfortable, or they're not confident, or so there have been times where they've seen that, okay, that art making can actually, it helps. It can reveal information that may take, like,
yeah.
many sessions to uncover. And then they become kind of ease into it. But yeah, I mean, there are sessions where I've only done purely EMDR, for instance.
Mm, okay.
And yeah, and sometimes in online sessions, uh, where some people are not comfortable with art making, uh, then you do talk therapy, and you can, incorporate bits and pieces, like
Hmm.
ask you to make a quick sketch, or you know uh, in 2-3 minutes. Most people would be okay to do that.
Okay. So you
Yeah.
explore those, right,
Yes,
limits
of course.
of
There's a lot of flexibility.
tolerance, of openness.
Yes, lots
Mhm.
of flexibility. There is no right or wrong.
Right.
There's no right or wrong. At the end of the day, you keep in mind that what is the goal? What is the purpose of the session? Why is the
Mhm.
client coming to
Mhm.
you? And you follow their lead. You go with what they want.
Yeah. And you have a number of tools to achieve that, right? Art
Yes,
therapy
exactly.
is one of them. It is
One
an
of them.
important one, is the main one maybe sometimes, but not the only one.
Yes, exactly. So you.
Mhm.
Mhm.
Okay. Thanks. The last question we have so far: do you think art therapy would work really well with nonverbal clients? If someone is wary of speaking to a therapist, talk therapy.
Yes, works very well for nonverbal clients because, as I mentioned earlier, it's a way of communication. And I have worked with nonverbal clients, especially with autism, who just simply don't have language. And then sometimes with the resistant clients who have the language but don't necessarily want to
Okay.
talk, and they don't have to because their artwork does the talking. And so, I mean, mostly with clients who can speak, they want to talk about their artwork after they've made it, and that's fine. But there is no need to if you don't want to.
Right.
And so you might say, okay, then how do you process the artwork? Well, you can process it by making another artwork.
Okay.
Yeah.
To
So
reflect
there,
that.
there are again ways. Yeah, 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 yeah.
So there is a dialogue between just
There's a
art.
dialogue, yes. And there's
Wow.
also an internal dialogue, right?
Hmm.
You
Hmm.
have with your own process. Because when you're creating something, when you're making something, you're also feeling something,
Right.
right? You're not a blank canvas yourself. So my goal also is to bring that awareness to the
Yeah.
person who is, of course, and this happens. This happens with practice. It's not going to happen immediately, but to bring awareness to, okay, when you are creating something, how did you feel while doing it?
Hmm.
Where did you feel maybe a particular tension or stress, and so on and so forth. And in fact, I'm trained in something called guided drawing, where you
Okay.
don't use language at all, and you basically just explore um, the trauma that is stuck inside in your body
Hmm.
using paint or pastels and your hand movements.
Wow.
So you don't even have to tell me what the trauma is.
Yeah.
Yeah, I just work with where you're feeling something in your body. So you might say, I feel something stuck in my stomach.
Hmm.
That's where we start,
Okay.
right? And we just work with that.
Right. So it can be really close to somatic therapy.
It's actually rooted in that. It is
Hmm.
actually rooted in
Hmm.
that. That's where this technique came from.
Wow. Yeah.
Yes.
Really
Yeah.
impressive. Okay. I think these are all the questions that we have so far. Thanks, everyone. These questions are really great, and they allowed us to learn even more about art therapy. Thank you, Huma, for sharing all this knowledge with us. I definitely learned a lot. I'm sure that our participants did. Um, I'll
Thank
just
you
take a
for
minute.
having me. My pleasure, always.
Yeah.
Yeah.
And if anyone is interested in art therapy, psychotherapy in general, or has any questions that they would like to ask us, feel free to get in touch with us through our website, filiawiththerapy.ca, or send us an email at info@filiawiththerapy.ca. And we'll be happy to either support you in your therapeutic journey or just answer your questions and help you.
Thank you. Thank you, everyone.
Thanks, everyone. Okay, have a good night.
You too.
Okay,
Bye.
bye.